a bill that I and Ranking Member Pallone have worked on to see that the Children's Hospital Graduate Medical Education Program does not expire on September 30th of this year. The CHGME program has been tremendously successful since first being authorized in 1999. It trains 40% of our nation's pediatricians and 43% of pediatric subspecialists. More than 5,000 residents take part in this program every year, and 56 freestanding children's hospitals in the U.S. participate. In the 1990s, we saw a 13% decline in the number of pediatric residents. However, since 1999, when the CHGME program was enacted, the number of pediatric residents has increased 35%. During the program's lifetime, $2 billion has gone to train the next generation of pediatrician and pediatric subspecialists. Despite its success, President Obama zeroed out the CHGME program in his FY 2012 budget. Secretary Sebelius told this subcommittee that while she regretted eliminating CHGME funding, the department had to prioritize where scarce resources would go. I agree. In a fiscal situation like the one we find ourselves in, priorities have to be set and difficult decisions have to be made. However, quite honestly, I'm not sure how a successful program like CHGME that trains 40% of our nation's pediatricians didn't make it onto the department's priority list. The program's current authorization expires September 30, 2011, and that is why I and Ranking Member Pallone introduced H.R. 1852 to reauthorize the program at the current level of $330 million over the next 5 years. This is a bill about the health and lives of this nation's children, and it is a fiscally responsible bill continuing the CHGME program at its current authorization. I would like to thank Ranking Member Pallone for his help and cooperation and for the work he has done on this important bill, and I would urge all of my colleagues to support H.R. 1852. Now, I have some time left. I will yield to any member seeking recognition on our side of the aisle. The Vice Chairman, Dr. Burgess, yield the remainder of my time.
Thank you, Mr. Chairman, and I appreciate us having the markup on these important bills. I am certainly grateful that the Children's Hospital GME Support Reauthorization Act of 2011 is before us today, legislation that's critically important to our nation's medical workforce. And in the decade since the program was first fully funded, it has indeed, as you pointed out, proved to be a remarkable success.
Mr. Chairman.
I yield to Dr. Gingrey.
Mr. Chairman, thank you very much. I just wanted to comment on how important this program is in regard to continuing medical education at the pediatric hospitals across the country. And I think the Chairman indicated there's some 56 of those, and it's really shocking almost that the President zeroed that funding out in his budget that he presented to us, maybe just assuming it would put it back in. But in any regard, if we did not have that funding, hospitals like Children's Healthcare of Atlanta on the Emory campus, which is such a fabulous training center for primary care physicians, particularly pediatricians, would have no funding in which to teach these young doctors. So with that, I'll yield back.
Thanks, gentlemen. Now recognize my friend from New Jersey, Mr. Pallone, for his opening statement.
Thank you, Chairman Pitts. I'm very happy to be here today to consider 3 bipartisan bills with great potential public health impact. We're one step further towards passage of H.R. 1852, the Children's Hospital GME Reauthorization Bill, which will ensure that we have well-trained cadre of pediatric professionals. In the 90s, CHGME single-handedly reversed the declines in pediatric training programs which threatened the stability of the workforce. At a time when we're still facing a shortage of pediatricians in New Jersey and across the country, we should not slow down funds for the pipeline of new specialists.
The Children's Hospital Graduate Medical Education Support Reauthorization Act provides ongoing and consistent financial support to hospitals for the training of doctors who want to specialize in pediatrics. Indeed, today, children's hospitals supported by this program train 40% of all pediatricians, 43% of all pediatric specialists.
Chair thanks the gentleman. Now recognizes the Chairman of the full committee, Mr. Upton, for 5 minutes for opening statement.
Well, thank you, Mr. Chairman, for holding this markup on the bipartisan Children's Hospital Graduate Medical Education, Bioterrorism, and Controlled Substance legislation. First passed in '99, this legislation provides support to children's hospitals for their pediatric medical residency programs. And today, 40% of pediatricians and pediatric specialists are trained with this funding. Even Secretary Sebelius couldn't explain the Obama administration's decision to eliminate this funding in their 12 budget, and this morning's markup is a bipartisan effort to ensure continued support for this very, very important program.
The Chair calls up H.R. 1852 and asks the clerk to report.
H.R. 1852.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. The Chair recognizes himself for 5 minutes. Children's hospitals are an essential component to our healthcare delivery system. The Children's Hospital Graduate Medical Education Payment Program is designed to help children's teaching hospitals, which do not receive significant federal support for their resident and intern training programs through Medicare. Since the program was first passed in 1999, the number of pediatricians in this country has steadily increased. The program has always received bipartisan support, and I am proud that H.R. 1852 now has over 100 bipartisan co-sponsors. I would like to thank Dr. Burgess and Ms. Capps for being original co-sponsors, and in particular, I would like to thank Ranking Member Mr. Pallone for all his work on this legislation. By reauthorizing this important program, we are able to help ensure that the mission of these teaching hospitals is continued. 5 years ago, when reauthorizing this program, the committee included accountability measures which required participating hospitals to report important data measures to the Department of Health and Human Services. H.R. 1852 continues these important reporting requirements and moves the report ahead by 1 year to facilitate legislative review. I urge my colleagues to support the legislation, and I yield back. Mr. Engel of New York is recognized for 5 minutes.
Thank you very much, Mr. Chairman. I want to say, like many of my colleagues on the committee, I was shocked when I learned that the President had zeroed out the Children's Hospital Graduate Medical Education Program in his FY12 budget. This is a very important program. It has strong support on both sides of the aisle. It's essential for the training of future pediatricians and helps preserve health services for children, especially those who are underserved and in need of special medical attention. I've seen firsthand the benefits of this program and the good work being done at Blythedale Hospital in Westchester County, New York, and believe they render a great service to us all. I'm proud to be a co-sponsor of the Children's Hospital GME Support Reauthorization Act of 2011, and I'm pleased that we're considering it at today's markup.
Are there any amendments to the bill? If not, the question now occurs on favorably reporting the bill to the full committee. All those in favor say aye. Aye. Those opposed, no. The ayes appear to have it. The ayes have it, and the bill is favorably reported. Without objection, staff is authorized to make technical and conforming changes to the bills approved by the subcommittee today. So ordered. I think that concludes the business committee. The subcommittee stands adjourned.